Insurance talk. Health insurance. What it covers? It covers hospitalization expenses to the limit of the sum insured. Some policies also allow lump sum payment in case of critical illness. Mainly policies sold are individual health policy covering individual person or with family floater. Family floater is a policy covering family with a single sum insured. Under employees benefit, the companies purchase the group health insurance. Due to the discounts offered on group policies, the premium rate is much lower than the individual policy. It may offer the benefit of maternity expenses also to the employees. The parents can also be covered under these policies. Otherwise, it is difficult to get the fresh policy to senior citizens. One can increase or decrease the sum insured on the renewal of the policy. But to get the benefit of the increased sum insured, the waiting period clause will apply. One can top up the policy to increase the sum insured. They can purchase top up or super top up policy. In such case, one should have the basic policy. Its terms and conditions will apply to top up policy. Critical illness policy covers diseases like paralysis, kidney failure, heart valve replacement. Allows you a one-time lump sum payment depending on your sum insured. The waiting period under this policy will be 90 days. The policy can be taken for self plus spouse plus children plus parents in multiples of rupees 1 lakh. There are some policies like Jan Arogya which are low cost, issued under the social sector scheme for BPL families. Condition of policy. There should be hospitalization for at least 24 hours. In some cases, due to the advancement of technology, this condition may be waived. What is reimbursed under the Mediclaim policy? Room rent. This is restricted to 1% of the sum insured and 2% for ICU. For example, if sum insured is rupees 5 lakhs, the room rent is restricted to rupees 5,000. If the patient opts for room rent of rupees 6,000, that is 20% higher, then his all expenses shown below will be reduced by 20%. There are sublimits also for some diseases like cataract, piles, hernia. This rider can be removed by paying additional premium. Nursing charges, doctor's fees, surgeon's fees, operation theatre charges, anesthesian charges, blood, cost of organs, cost of artificial limbs are paid. Medicine cost during hospitalization and 30 days prior to admission to the hospital and 60 days after date of discharge from the hospital is paid. Waiting period. Generally, there is a waiting period of 30 days for fresh policy, except for accidental case. Some diseases are not covered in the first or second year of policy, like cataract, prostate, piles, or hernia. If there are any pre-existing disease, then for the first 48 hours it is excluded. What it does not cover: cosmetic surgery, plastic surgery other than accidental case, dental treatment other than accidental case, self-injury, a congenital external disease, that is disease from birth, injury by use of drugs, alcohol, rundown condition or rest cure, general debility, cost of specs, hearing aid, charges incurred in the hospital primary for diagnostic purpose, charges incurred for childbirth or traceable of pregnancy, any breach of act. On admission to the hospital, the intimation to the policy issuing office is to be given within 24 hours in writing or through email. Claim form is to be obtained from the insurance company and to be filled properly with policy number and other details. Part of the claim form is also to be filled by hospital. All original bills, receipts, reports, prescriptions and discharge card is to be attached to the claim form. Regarding post-hospitalization medical bills for 60 days, a supplementary claim can be made. Cashless hospitalization. Cashless hospitalization is done by TPA, third party administrator. It is a claim settling agency appointed by insurance company. They have the list of network hospitals with whom they have agreement. They have counter in major hospitals. Patients can inquire about the hospital. In network for cashless facility, one has to approach to the TPA counter or TPA office with the policy number. Looking at the sum insured in the policy and the nature of treatment, they will approve some advance amount to the hospital. If the supplementary amount is needed, again one can approach TPA office. Restoration of sum insured. If the insured is having a policy with a sum insured of rupees 6 lakhs, if he utilizes rupees 4 lakhs in any claim, so balance sum insured will be only rupees 2 lakhs available for that policy year. By paying an additional premium, this sum insured can be restored to rupees 6 lakhs. This facility is only available to policies having sum insured of rupees 5 lakhs and above. Thank you.